Hi, my name is Tanya. I'm the nurse, and you are?
I'm Nathan.
Nice to meet you, Nathan.
Nice to meet you too.
So what brings you in today?
My right knee has been in a lot of pain recently.
Okay. Is it okay if I just take a seat?
Yeah, sure, go ahead.
So I'll go ahead and get a full background history on you, and
Okay.
then we can do an examination.
All right.
Okay. So Nathan, how old are you?
I'm 67.
Okay. And what gender do you identify yourself with?
Male.
Male. And what's your occupation right now?
Well, I'm actually retired, but I used to work as a bus driver.
All right. So this knee pain, you mentioned, when did it start?
Oh, well, 6 months ago, I went to another clinic and they diagnosed me with stage 2 osteoarthritis.
Okay. And just the right knee or both of your knees?
In just the right knee.
Okay. And so they diagnosed you with osteoarthritis?
Right, and they recommended that I do some exercise, so I began jogging, but since then, the pain's been getting a lot worse.
All right. When you went to the clinic, did they mention high impact or low impact exercise, or they just...
No, those words don't sound familiar to me.
So you have been jogging since then?
Right.
For a while now. Okay. And this jogging that you do, how often do you do it?
Well, I try to go every day, but I think 6 times a week is a better guess.
6 times. Wow, it's a lot.
Mm-hmm.
And is it intense? How long do you jog for?
Well, I'm not a very experienced runner, so I don't go that fast,
Okay.
but I go for about half an hour.
Half an hour, 6 times a week?
Mm-hmm.
Okay. And can you describe the pain for me?
Well, when I'm jogging, it becomes a really intense, sharp pain, but just throughout the day, I also experience some pain, and it's kind of like a dull ache. But I'm used to this, so I don't pay much mind to that.
Okay, so you're always feeling pain nonstop, but it's just dull?
Right.
Okay. And if you had to rate from a scale of 1 to 10, 10 being the worst pain ever,
Okay.
how will you rate it when you're jogging in comparison to when you're sitting down right now?
Well, when I'm sitting down, it's a 2. Like, I really don't pay much attention to it, but when I go for a jog, it'll go to an 8 or a 9.
Wow. And do you take anything for that pain, or?
I used to not need to, but after I jog, I take a Tylenol sometimes.
And does that help?
It does help, yes.
Okay. And so you've been taking a Tylenol every single day?
Not every time, but if I feel it.
If you need to? Is there anything else you do other than the medications?
Well, usually if I rest for a little bit, the pain will subside, so I usually stop running and I find somewhere to sit.
And is there a certain time of the day where the pain is worse than the others?
No. Sometimes in the morning when I wake up, my knee will feel really stiff, but no, not really.
So after prolonged resting, your knee feels stiff?
Yeah.
When you get up?
Yeah, I would say so.
So have you noticed any swelling or heat from your knee?
Yeah, my knee does look a little swollen and red sometimes.
Sometimes it looks swollen and red?
Mm-hmm.
Okay. And any other joints in the body, or is it just your knee?
No, it's just in my knee.
Just in your knee. And in regards to other joints in the body, has there been any limitation of movement?
No.
And with the knee, does it affect your just daily living? So when you're grooming or dressing?
Well, sometimes it's hard for me to go up the stairs, or dropping something, it's a little difficult for me to pick it up, but I usually manage.
Okay. And do you experience any muscle pain or cramps at all?
No.
Any back pain?
No.
No. Has there ever been a history of any bone or joint problems in the family?
Yes, my mom was actually diagnosed with osteoarthritis in her hips.
Okay. And have you ever been in an accident or experienced any trauma?
Not that I can recall.
To the knee?
No, nothing.
Nothing. All right, and I think that's good for the health history. If I need to, I might ask you a few more questions as I
Okay.
go on with the examination.
Okay.
So we'll just start with the examination now.
Okay.
So throughout this physical examination, I will be looking at several joints and bones throughout the body,
Okay.
and I'll be looking at the swelling, the temperature, the contour and the shape, if there's any deformities or masses, anything like that. If you feel pain at any time, just let me know,
Okay, I will.
and we'll look more into it. So starting off with your jaw, I'm looking at the shape and the contour, and it looks nice and even on both sides. And I'm going to ask you to go ahead and open and close your mouth. Okay, so here I'm just listening for a click and I didn't hear anything.
Okay.
And if you can just move your jaw left to right for me. Okay, and clench your teeth. So here I'm just going to feel for the muscles. Okay, my hand here and ask you to push against the force of my hand. Okay, so here I'm just testing for muscle strength. Perfect. Now if you can just put your chin to your chest and look up to the left and right. Okay, and if you can put your ear to the shoulder without lifting up your shoulder. Okay, and same with the other side. So you're not feeling any pain throughout this?
No.
They're both nice and even. I don't see any masses or deformity.
Okay.
And I'm just going to palpate, so I'm going to just feeling around for any deformity. And to test the strength, I'm going to apply force here, and you're just going to push against my hand. Okay, that's good. There's some range of motion.
Okay.
Okay. And if you can just have your arms out, palms up, and elbows extended, and then just like that, go all the way up. Okay, and bring your arms up on the side and to the back. And just lock your hands and then extend your elbows at the back. So no pain here or anything?
No.
Okay. And then just bring it out and put your palms together at the top. Okay, and bring your hands down and put it at the back of your head. All right. And just have your hands to the side now. That's good. Thank you. And you can have a seat.
Okay.
So now we're just going to look at the elbow. And so I'm just inspecting here. And looking at the contour and the shape. So if you can just hold my hand. I'm just going to. Okay. And same with the other side, just feeling around at your elbow. Okay. Test your strength here, and I'm going to put my hands here and apply pressure. Just try to push against the pressure. Okay. And same with the other arm. All right, that's good. And I'm going to look at your hands, the contour of your hands, the bones and the joints. I'm just going to feel. And you're not feeling any pain or anything?
No.
Okay. All right, and I'm going to ask you to touch the tip of your fingers with your thumb and the base of your pinky.
Okay.
And same thing on the other hand. All right. And then I'm going to ask you to put your arm out and bend your wrist and your fingers down and then up. Okay. And then I'm going to ask you to open your hands up, and same thing on the other side actually. Down and then up. Okay. And if you can just have your hands out like this and form a fist for me. Okay. If you can just put the back of your hands together like this and leave it like that for 60 seconds. We're just going to check for carpal tunnel symptoms such as burning or any numbness. So if you feel any of that, just let me know.
Okay.
And I'll just pull the desk over. Okay, now that 60 seconds are done, I'm just going to take a look. If you can let me know if you feel any sort of burning or tingling while I do this.
Okay. I don't feel any.
You don't feel anything?
No.
Nothing in your fingers? Same thing on this side?
No, nothing.
Okay. For the next test, we'll check the range of motion. So if you can put both your hands right on the table and then bring it in and then out. That's good. So now I'm just going to move the table to the side again, and if you can lie down for me, I'll do the hip assessment. So So I'm just looking at the hip for any swelling or any abnormalities.
Okay.
And I'm just gonna feel for the joints to make sure they're stable and symmetrical. Okay. And now are you able to extend your leg any further?
Well, while I was sitting down earlier, it got a little stiff, so not really.
Okay. Well, if you can extend it to the best of your ability and just lift your leg up.
Okay. Ow. I don't think I'll be able to go any higher.
That's okay. So let's try the same thing with the other leg. If you can just extend it as far as you can, lift it up. Okay. And is that painful at all?
No.
No? So there's definitely a difference between the two legs and how far you can go up. Can you try bending this knee and lifting it to your chest and keeping the other leg flat?
I think this is as far as I could go.
This is as far as you can go? That's okay. We'll try the other knee now. If you can just bend it towards your chest while keeping this flat. Okay, and no pain at all?
No pain.
All right. You can bring it back down. And now I'm just going to ask you to bend your knee as much as you can.
That much.
Okay. And I'm going to hold onto your ankle and your thigh as you just rotate in. Is that painful?
No.
Okay. And then I'm going to do the same thing with the other side. So just rotate in. Okay. That was good. And you can just keep both your legs flat. And
okay.
So swing this leg towards me. Okay. And back it. And then do the same thing with the other leg. Extend it as much as you can. That's good. So I'm just checking for range of motion here.
Okay.
Now I'm just looking at your knees, inspecting them for any abnormalities, any masses. And while I'm looking, I don't notice any swelling.
Well, most of the time I see swelling after my jog.
And that's usually just in the right knee?
Right.
And is that the only time you notice swelling?
Yes.
So clearly this is the affected knee. So I'm going to go ahead and do, it's called a bulge sign test. And I'm just looking for any accumulated fluid. So I don't notice a bulge. So I'm just going to ask you to lift your knee up now. And I'm going to support you from here and your ankle as you just move in and out. So here I'm just listening for a click, but I don't hear any. Is this painful for you?
Only a little.
Just a little bit? And what kind of pain is it?
It's just like a sore tenderness.
Okay. So here I'm just looking at your ankles and your feet. So I'm looking at the color, the contour of your joints, and noting there is no swelling or anything. And now if you can just lie back down for me. So I'm just supporting your ankle here as I feel around for your joints and look for any swelling, any tenderness. And same thing with the other foot. And you're not feeling any pain when I do this?
No.
Okay. And then I'm going to do the same thing for the back of your foot. And same thing here. And I'm feeling for the surface. It's nice and smooth. Okay. And if you can just point your toes towards the floor now, and then towards your nose, and turn the soles of your feet in, and then out. Okay. And then I'm going to ask you to flex and straighten your toes. All right. Perfect. That was good. Now I'm just going to ask you to stand up.
Okay.
And I'm going to look at the back and your spine, just the curvature of your spine as
All right.
you touch your toes. Okay. And this isn't painful or tender?
No.
All right. You can stand back up. And now if you can just bend to your side, okay, and your other side, and try to keep your hip in place as you twist to each of your shoulders. Okay? While you're still standing, Nathan, I'm just going to go ahead and check for your range of motion for your knee. So can you just extend your leg out and go out, and then bend and go back, and do the same thing with the other one?
Ow, it hurts when I bring it backwards.
So the right one hurts when you bring it back?
Right.
Okay. And now can you just do a little squat for me? Just bend down a little. Okay, and is that painful?
On my right knee it is.
And I noticed that you're not able to bend your right knee as much. Okay, so you can bring it back up. And then can you just go ahead and do a walk for me? Just a few steps. And notice that you're limping a little bit. So Nathan, throughout my examination, I did notice that your right knee is more stiff and has has less range of motion in comparison to your left knee.
Okay.
So I want to talk to you about your exercises. And you said you've been running for 6 days?
That's right, six times a week.
6 times a week. Well, that is putting a lot of stress on your joint. So we want to minimize as much stress as possible.
So should I stop exercising?
Well, no, you could do low impact exercises such as walking or walking in the shallow end of the pool.
Okay.
So in water, that's great. And any aerobic exercises is
Okay.
fine. And we also want to apply a heat pack. You can apply a heat pack to your knee before your exercise, so that
Okay.
will increase the blood flow and it'll decrease stiffness.
All right.
And right after you've done your exercise, you can apply an ice pack that will relieve any pain and it'll be soothing.
Okay.
Any discomfort is normal when you're doing exercises, but feeling pain or noticing any swelling or redness is not.
Okay,
So
all right.
we want to prevent that. So I'm going to go ahead and report my findings to the doctor. She
Okay.
will come in and see you shortly.
Mhm.
Are there any other questions that you have?
No,
for
I
me?
just had that one question if I should stop exercising. You already answered that.
Perfect. All right. It was nice meeting you, Nathan.